We're live.
Welcome back to the COVID313 Coalition for Families and Students Town Hall. I'm Christine Bell. I am honored to serve as the Executive Director of Urban Neighborhood Initiatives, and I'm a proud member of this coalition. We have a really exciting town hall for you today. We have a wonderful doctor here, and DPSCD and some charter folks representatives. And we are just, and most importantly, well, not most importantly, but we also have Senator Peters that will join us today. So we have a really exciting town hall today. Please remember that this is a two-way conversation, and so we really want to hear from you. You can put your comments or questions in the Facebook chat, and you will notice that we are streaming in multiple different Facebook pages, and so we have a few more moderators today. So we are definitely committed to hearing from you. Lindsay, Brooke, Michael, Colleen, Molly, Rita, and Deja are at the ready to take your comments and questions. So make sure you put those in the chat just to make sure that they are paying attention. Why don't you let us know how you heard about today's town hall? Like always, we're translating the town hall to ASL and to Spanish. So we want to give folks time to get on the right line and get comfortable. Julie is with us again today. So Julie, could you please share how to view the ASL interpretation? Thank you so much, Julie. It's so good to see you. Feels like a long time, but it's only been a week and a half or so. And then also we have Miss Christina Guzman with us today, and she will be sharing the instructions for Spanish translation. Christina?
Sí, buenas tardes. Si quieren escuchar en español la traducción, por favor vayan al Facebook de Urban Neighborhood Initiatives de UNI y está en vivo, y también en el chat hay un enlace. Gracias.
Thank you so much, Christina. It's wonderful to see you as well. And we want to thank our experts for being here today. Again, we have Alicia Merriweather from DPSCD, Rajeshri from Grand Valley State University. We have Dr. Eric McGrath from Wayne State. And then we have Senator Gary Peters. He's a U.S. Senator for the state of Michigan. And we wanted to remind you all before we get started to speak slowly for our translators. We want to make sure that they're translating the important information that you're sharing correctly. We also want to remind you to turn off your camera when you're not speaking to ensure that our ASL interpreter can be seen, and mute yourself when you're not speaking as well. Terry Whitfield, the best timekeeper that I know, is timekeeping for us today, and he will remind you in the chat your remaining time. So keep a lookout on the chat. And then if we're going over, myself or Jametta will gently remind you to wrap up. So let's get to it. Jametta, I am passing the mic to you to make our first introduction.
Certainly, thank you, and proud and happy to accept the mic. Jametta Lilly, I am so blessed to serve as the CEO of the Detroit Parent Network, and I am a proud Detroiter, Nana to wonderful grand twins too far away in Texas, and also a proud member of this coalition that now for almost 2 years is continuing to bring information to keep us powerful and informed and safe. So as we think about safety and we think about staying powerful and informed, it is so important during this time period that we continue to be diligent in trying to understand what is going on with the education of our children. What are the factors that are impacting whether they go to school, stay in school, testing, and so importantly, how not only are they learning, but how are they feeling? And who better, obviously, to have this conversation with than the leadership from our Detroit Public Community School District, as well as leadership from the multiple charters across the city of Detroit. So what I'd love to do is bring on screen our two school leaders who are themselves parents and focus on how, in fact, we can navigate the complexities of this very challenging time. So joining us is going to be the Assistant Superintendent, Alicia Merriweather, and also Rajeshri Bhatia. Bhatia is a part of our coalition, but Rajeshri shares the hat of being the director for the Detroit Charter Programs with Grand Valley State University. So ladies first, I'd love to just have you come on screen and welcome you to the program. I want to start off with, and this is really want to have a conversation over the next 15 minutes about your perceptions and some of the information that we can give to families, as well as the community folk who are here to support our schools and support our families. But first off, how about we get an update on how are you making the choices right now about the return to school, either in person or virtual? Alicia, would you be kind enough to start us out? How are those decisions being made about those choices?
Good afternoon, everyone. Thank you for the opportunity to speak with you today. To start with, I think anytime we talk about decisions being made related to virtual or in person, you understand they're very complex, and it's a really important decision that is being made because we understand anytime that we're not in person, there's a lot of things that get impacted in people's lives. And we also know that COVID is impacting people's lives and health as well. So it's this balance between understanding what's happening with COVID and then what we feel comfortable about in terms of having schools open. So what I will say related to DPSCD, we are online, as you know, currently, but we will be returning on Monday, January 31st. All staff, all students, everyone will be returning in person on Monday, January 31st. And that decision was made because we do see the COVID positivity rate in the city going down. So back in December, Detroit's positivity rate was about 40%. We also knew from staff that was testing the week of December 27th, we had staff testing voluntarily. They were coming in at a positivity rate of 21%. So in December, we knew we had about 800 staff with COVID in the district. And that meant at that time, the isolation guidelines and the quarantine guidelines were, 10 days out. And so you're looking at staff shortages, and you're also looking at COVID in the community being at a very high rate. So in conversations with the Detroit Health Department at that time, basically what was explained to us is that there's a forest fire in the community in terms of COVID. And anyone that has ever seen a forest fire or has watched news coverage knows that you take a burning log from one forest fire and then you have another forest fire happening because that log has come into a new forest, right? And one of the ways that we prevent spread is by digging a trench. And so the health department advised us, so we had long conversations that in order to stop that spread, to stop that jump, we needed to build a trench. And so we have built that trench. We have seen the numbers going down both in our schools for folks who are in person. We do have a weekly testing protocol. So we have a very robust dashboard where we can see everyone who's tested and their results. We now see this last week, our positivity rate among the district staff that was testing was about 2.5%. That's down from 21% in December. And so we feel confident now at this point that we can return safely. In addition to the city rates going down, we're seeing, of course, our own data showing that the numbers are going down. But that in addition to masks, social distancing, temperature check, symptom check, contact tracing, weekly testing. So it's all of these things together. So I'll pause there, but we are returning on Monday. It's back to in-person learning, and we'll, of course, resume our weekly testing, saliva testing that happens at every single school across the whole district.
Alicia, thank you very much. And that's great news to hear, because we had the benefit of having Dr. Vitti 2 weeks ago, and he forecasted with a lot of confidence that the district would be able to get back. But as we knew, the variable in all of this is COVID in our own community. And we appreciate you looking at the multiple factors of data to inform this decision. Rajeshri, you are working with another complex environment too. Not only the complexities and challenges of COVID, but the fact that Detroit has a very fragmented, quite frankly, charter system. While we have some great schools, it's hard for our parents to navigate it. So we are grateful to have you with us to help try to give some sense of where our charters are, who are also navigating these complexities. Can you tell us about what does it look like about return to school versus virtual amongst charters throughout the city?
Sure, absolutely. Thanks for having me on for this very important topic. I think, like Dr. Meriwether talked about, similar strategies, looking at what is happening in the community, and because charters are sort of scattered throughout the city and have students from throughout the city, that I think they focused in on the communities that they serve, and then also just sort of what can be done. And so we've had, I think, a mix. We've got some schools that have chosen to remain remote for until next week, and we also have a number of schools that did feel as though they could institute the right kind of safety protocols and put in place programs that would keep kids and teachers safe, and those schools have been operating since we got back in January. The thing about charters is that our schools are smaller and we're independently governed, so there is a group of people, specific group of people for each school making the decision, which allows them to really look at the individual school, the school community, and kind of what the needs are. And so there's a little bit more flexibility and nimbleness than maybe DPSCD is afforded, simply because they are a much larger institution, kind of having to govern a much larger group. So that's, I think, that's the way we've done it. I think the decisions have been a collaboration between school boards, school leadership, parents, and community. And we have seen parent input at a number of our board meetings, kind of supporting and giving their feedback. So, but I do think that all of the schools that have gone back have reported that things are operating smoothly. Yes, there have been cases here and there, but we haven't had huge wide outbreaks. We haven't had huge wide teacher shortages. And so I think they've done a very good job of mitigating the risk and doing, and allowing the schools, the students to come back.
Rajeshri, thank you. Just a follow-up question. I think you made a good point, which was because those districts are smaller, that enables them to actually zero in on a smaller band of schools, which may in fact have a different set of data versus a system-wide that the DPSCD has to do analysis of. Could you, or do you have a sense for how many of the charters are now remaining in school or either returning back to in person?
Sure. So statewide, I can tell you the majority of charters remained in person. And the only places that we saw schools that did not reopen was in the Detroit area, which makes sense given the numbers across the state. In the Detroit area, again, I would say more than half reopened. And then there was, but then there are a certain number of schools that decided not to. And what I see with those is, again, those are some of our larger networks that I think, similarly to the decision making, have to make a decision for a wider swath of a community. If you have 10 schools or 7 schools or something, you're looking at a much wider group of folks. And so the decision making is slightly different. I think you keyed in on it there. So, but I'd say more than half, probably 70%, I'd say are open. And then the rest, and that really is limited to some of our larger districts that within the charter system that have decided to reopen either this week or next week.
Okay, great. So a reminder to families that are there, if your children are in the district, you'll be back in school next Monday. And if you are with a charter, then you really need to check with your school if you don't know that status. So, and both of
all
you,
of the charters,
go ahead.
all of the charters will be back by next week. The ones that were open or decided to go remote the longest are all going back on Monday. So.
Okay, so we got the 31st is a big day across the city of Detroit. And for working parents and folks trying to juggle all of this, it helps to know this in advance. The two of you raised one of the other important protocols, which is testing. Can you talk a bit about how you are faring with getting the permissions from families to do the important testing, so that's part of your mitigating COVID? Alicia, could you speak to that? And then Rajeshri, to follow up on that question of testing and parents' level of providing permission to do that. And if not, how are you trying to engage families?
Yeah, great question. So the district implemented weekly testing. We started doing this last May and June, and then continued to ramp up. And so when we came back to school this fall, we offer weekly saliva testing. So we do not do the nasal swab. We do saliva testing to make it less invasive. So we've been doing that since the fall and across every single school. So there is a testing on site at the school or work location every single week. Employees for us is mandatory, so they must test every week. And then for students, we must have parental consent. And so some of the ways that we've worked on getting information to families, we created an informational video. We pushed out the consents through text. We've got the permission forms are in all of our standard languages. We've got principals and our family and community engagement office, everyone working to make sure that people understand how the testing works, how easy it is, and then working to get those consents back in. We also have a very comprehensive, robust dashboard. So everyone who's tested, it automatically goes into our dashboard. So we're able to actually drill down into every single school to see the positivity rate by school. So while the district made the decision to suspend in-person learning at scale for the last few weeks, prior to that, we made decisions based on individual schools because we can see very clearly the positivity rate by school. And so that will not change. Moving forward, based on the guidance from the health department, you start looking at, they changed a couple weeks ago to say if there are 6 cases or 20% of a cohort, that whole cohort or homeroom must quarantine. But beyond that, when you're looking at a school, if you start to see a school itself that is having higher percentage of positivity, we would work with the health department to close that school because it's an independent context, not the whole district. But if you have particular schools where you're having issues, we're able to drill down and see exactly what's happening at each school. And that is publicly available on our website, detroitk12.org/COVID-19. You can do a drop-down menu and see positivity by school, which I think is really great for families and the community to see that. Right now for consents, we are at 91% of our students consenting. And basically when we come back on the 31st, we have said to families, if you're going to be in person, you need to have a consent on file. And so what we're looking to see is that every single student and every single adult that's in our building is testing every week. And so that is our plan moving forward. We'll continue to work with families to get those consents in, but we're currently at 91% of our families have consented.
That's good news. If I recall correctly, a couple of weeks ago, it was at 70%. So this is wonderful. And also know that many community-based organizations are supporting you in this by making sure that they're pushing for that consent as well. Rajeshri, how's that going on the charter side?
It's so encouraging to hear that all those efforts are yielding the kind of results they are. And it follows that parents are really trying to do what's best for their kids. And so I think the same is true. At the end of the day, whether you're in a charter school or a DPSCD, you're coming from Detroit, you're from the same community. So it's the same, we serve the same populations. like with many things, each school has its own protocol for testing and the communication piece. And from what I understand, are seeing similar types of compliance when there is a mandate. Now, not every school has a mandate. You know, there are lots of different mitigation strategies that schools are using. But at the end of the day, what we're seeing is that we're seeing schools be able to keep, you know, we're seeing healthy schools right now. We're not seeing mass outbreaks. We're not seeing mass exodus. Maybe during the sort of spike we had, you know, over the course where everybody was seeing it. But we didn't have many school closures because of that, you know. And I think at the end of the day, we're all trying to do what's best for kids, and the mitigation strategies, whether it's the testing protocols at DPS and CD and some of the charters or other strategies, are working because we're all working together. And so parents have been equally supportive, I would say, in both systems.
And I want to piggyback on something that you just stated. You use that word healthy schools because we know for our kids, in order to learn, you gotta be healthy. And whether that's nutrition, our social, emotional, mental health. I just want to veer for just a moment about the health aspect of that. So we know through ESSA and, you know, huge amount of funds that have been made available through the feds to the state, there's new opportunities to increase social, emotional support as well as physical health support. Alicia, as well as Rajeshri, could you talk about the role that school-based health clinics may be playing right now, and or do you have school nurses in every school? Let's talk about that. Is that a resource now that families can say, yes, my school has a school nurse, there's a school-based health clinic that's there to help get those well child visits and immunizations, et cetera. Alicia?
Yes, so DPSCD has 19 school-based health centers. Primarily on the east side, they're supported through Ascension, and on the west side, they're supported through Henry Ford Health Systems. In addition to our school-based health centers, through COVID relief dollars, we do have a school nurse at every single school. That is true. We have a school nurse at every single school. We have an isolation room at every single school in terms of the physical health. What's very exciting is, we're also working with the state to be able to offer the COVID vaccine directly at our schools through our school nurses. So that will be coming in the next couple of weeks. We've been collaborating with Wayne Health and Detroit Health Department for COVID clinics, vaccine clinics, since the vaccine first became available for minors. But this will be a next level. This is going to allow us to offer the vaccine at every single one of our 107 schools on a regular basis. And so that is only possible through these school nurses, really, at every single school. And I want to touch on your other point about mental health. So the other thing that happened this year that's pretty important at DPSCD is because of the COVID relief dollars, we were able to increase tier 2 and tier 3 support at all of our schools. So we actually added tier 2 and tier 3 support at 86 schools. So that is a critical improvement.
Could you share with the listeners what tier 1, tier 2, or tier 3 support is?
Sure. And I just got a message from my computer battery, so I hope that there's not a problem. But tier 1 is general social emotional learning that happens in just a general setting. So it's talking about coping strategies. How do you deal with stress? Just general strategies. Maybe it's breathing exercises, counting exercises, meditation, etc. Just general instruction. Once you've done a screener of some sort, and we administer the Universal Mental Health Screener to determine if there are deeper needs, you look at tier 2 and tier 3. So if somebody needs additional support, that could be small group, that's usually tier 2 intervention. And then tier 3 is usually individual counseling. Crisis is the next level and is an immediate, it could come at any point because there's a crisis. But when you're talking about tier 1, that's general instruction. Same as when you're talking about academics. Tier 1 is your general that goes to everyone. Tier 2, you realize someone needs a little more intervention, you have small group. And then when you have very serious issues, you're looking at a tier 3 individual counseling. And so we've been able to increase through 5 vendors that are basically serving an additional 86 schools over what we were able to serve last year. And so that's really exciting. It's a major improvement that I hope there will be additional funding sources to support after COVID money is gone. I think we all recognize there is a serious need for mental and physical health supports. And the school is one of the best places to do that. You have a captive audience, and we also know that students learn better when they're healthy, mentally and physically.
Yeah, absolutely. And thanks for sharing that great news. As we first heard in the Racial Disparities Task Force, that opportunity with the Detroit Health Department and Wayne Health for there to be direct vaccines in schools. This is big news, and it's a great cooperative effort. Rajeshri, hoping that some similar opportunities are available for charters, but also if you could speak to that aspect of mental health and social emotional supports.
Absolutely. And as is the theme with charters, similar but not the same.
Right.
So one of the things to keep in mind with respect to the ESSER funding is it's based on your student count. And so many of our schools are much smaller, right? So our larger districts received larger awards that they could leverage across multiple schools and do some different things with. Some of our smaller schools, which is the majority of the schools, got a smaller amount of funding based on their student enrollment. And so a lot of them have put that to use in some of the mitigating strategies that I talked about, the direct, sort of student stuff. So as far as health clinics and individual school nurses, it varies school to school. And again, it was all about how they prioritize how to use the funds. Many of the smaller schools in particular decided to use those funds for something, more direct immediately, because there just, quite frankly, wasn't enough to sustain like a school nurse or something like that long term. So I think, again, an individual school piece. But one of the things that I've heard a great deal about, and we spoke about the student mental health, is the teacher mental health issue, and the fact that, compassion fatigue is real. And so one of the things that I've heard a great deal about from our school leaders is the need for more support in that area. So that is where many of us who are supporters of charter schools on the outside, right, as an authorizer, we don't operate schools. There are certain parameters for which we set some rules, but otherwise, schools really are empowered to operate on their own, but we can support. So we have, as an authorizer, been offering some different kinds of professional learning and professional development for teachers in terms of trauma-informed education, as well as self-care, and really have tried to help our school leaders zone in on that group as well, because they do carry so much of the responsibility on their shoulders. One of the big drivers is we've also done a good deal of data analysis of student performance over the last 2 years. And I don't need to tell anybody that, clearly we were already struggling and there were obstacles, and it doesn't matter where you went to school. The last 2 years were not a stellar year for any school. And so we've used that as our basis for the why, right? Why do we keep doing what we're doing? And teachers are motivated by that, because at the end of the day, they absolutely want to serve their students. And so if you couple some direct, specific support for teachers with this like constant motivation of the why, as well as provide the resources that they need, we've been able to help schools kind of keep their staff going. But it's an ongoing thing. And that's something we all have to recognize as a community, that our teachers need our help and need our support and need to be told, and need to be affirmed for all the wonderful things that they are doing. So that's part of our messaging also, is it doesn't start and end now. Something we need to continue to do, and honestly should be a regular habit of ours anyways.
Now, thank you so much for lifting that up, because I think too often we forget that good schools are a partnership, a loving partnership, a focused partnership between that child, the parent, and the educator in that classroom, and obviously the system around them that supports those kids, families, and teachers. And I think you use a term that I'm going to make note of: compassion fatigue. Teachers are struggling with it. So are folks in mental health. So are the agencies, all of us that are at the forefront of trying to support our families. So a couple more questions before we wrap up this segment. I would love to hear a little bit about technology. You've talked about the dashboards, for example. Technology is so critical, and it's been a real challenge for families. Where are both the district and charters in terms of the overall percentage of families that have received laptops, and that you would say, if you had to grade yourself on the utilization of the tools, getting the tools is one thing, but the utilization is another. A few comments about that. Rajeshi, why don't I start with you, and then we'll go to Alicia.
Absolutely. So for the schools that was part of the decision making, honestly, for some of our schools in terms of in-person, remote, because obviously if you're going to do remote, we have to ensure that everybody has access. And
Yeah.
so for the schools that decided to go remote, absolutely there has been access and there's been a good utilization of the technology under the current pupil accounting laws. And I don't want to get very like technical on this, but there are certain ways you can do it, as we all know. And so they've been very diligent to those rules. And teachers have been utilizing the technology that's been provided to them. For some schools, they've gone remote, but they've kept the school building open for teachers to come in and teach if that's what, works best. So I say, in a pandemic, I don't want to have grade inflation. I'd give us a B plus, A minus on that for the schools that decided to do it. But then again, a good number of our schools decided to remain in person as well. So, it's kind of a skewed grade because not everybody did it the way that, that DPS did.
Yeah, well, we know grading is complex. Okay, Alicia.
I agree. Grading is very complex. But I would say overall, one thing we knew when the pandemic first started, and it's hard to believe we're coming up on 2 years since March of 2020, when you think about it, that when that hit, we knew that approximately 80% of our families did not have an educationally adequate device or internet at home. And so we knew we had a major issue. We didn't have a choice at that time to do anything but figure out a solution. And so at that time, we launched Connected Futures, which raised $23 million to provide devices, internet access, and tech support. So one thing I do want to be clear on, it's not just about the technology, it's about internet access and about tech support, because you can give people a device, but if something happens, that device is basically a doorstop. So you've got to have a system. And so the district created these tech hubs where people could bring their device for service. We worked with Human IT to provide a hotline for people to call. We put all kinds of things in place. We have door knockers, canvassers going out to help families. And I would say even in this, after the initial distribution and then follow-up, like just now when we were going remote for this period of time, we put the tech hubs back up and we gave out loaner devices, even for people who we've given multiple devices to. We gave another device because, to the point that was made, if you're going to be online, you have to give the support. And so we've done that. And I will say this is very challenging because the supply chain is still having issues.
Yeah.
And so by giving out supply, so we've given out loaner devices that are technically the school supply, then you've got to then fill in that hole, and you're waiting for the supply chain issues to be resolved. So we will see how this works itself out, but we decided in the moment we're online. We've got to give the supplies that folks need. Now, did everyone take advantage of that?
That's another thing. Alicia, I'm so sorry. I asked you a packed question and we're all wanting to hear more because the digital divide is such a huge issue. But we actually have to kind of make a transition to our next speaker. I want to tell you, Alicia, how appreciative we are of you and Rajeshi, both of you, for not showing your compassion fatigue, because we know that you have it too. And we're so glad that your leadership is helping both our teachers as well as our children and our families. So thanks you so much. And Christine, I'm going to transition to you now so that we can go from talking about obviously education to how we stay healthy through Omicron and its impact on our children.
Thanks, Tamara. We had 2 questions from the chat that I just want to quickly raise. Alicia, if you could pop back on, and Rajeshi, and if you could keep just 30 seconds, I'm sorry to. So the first is there a process in place to assist special needs students in getting vaccine?
I can speak from our perspective. Definitely, we've held town halls specifically related to exceptional students. We've worked with the physicians whose specialty is around special needs students along the various different spectrums. So we've had special physicians, we've had town halls, we've done special vaccine clinics focused on special needs. And so the short answer is yes. And so I do think there's probably more that can be done in that area and working with the health department. And then as we get our vaccine directly at our schools, I think that's even going to be more helpful because you're giving the vaccine at a site that is very familiar and comfortable for young people with staff who is trained specifically. They're already working in that school environment, our center-based schools especially. So I'm looking forward to that happening in the next couple of weeks. But yes, we have done special accommodation, but I think we can even do more now that we'll have the vaccine directly.
Okay, Rajeshi, is there anything you'd like to add?
No, the only thing I would add is I think we've just provided the opportunities, the education, and sort of facilitated as much as possible. But I think at schools, this is a similar sort of approach.
So we also had somebody say that they're really concerned about going back to school. They have 6 children. They're all different ages, so that some cannot get vaccinated. And she's finding it difficult because, they're not learning much virtually. And so she knows it's important for them to go back to school, but bars and restaurants are still open. And that parents are really getting kids sick because they're going to these places or people are that come in contact with kids. This person said that she thinks that these things should close first. But the question really is, are schools required to contact trace?
Yeah, so first thing I would just like to clarify is currently anyone 5 and up is eligible for a vaccine. So anyone 5 and up is eligible for a vaccine. So if your child is in school, kindergarten or up, they are eligible to be vaccinated. That's the first thing I'd like to clarify. Second, when we talk about safety, so the vaccine is definitely one of the first defenses, also weekly testing. So I would also say to sign up for weekly testing. That's a way that you can monitor health. The very specific question related to like what was the root of the question there at the end? Because the piece about the vaccine.
Are schools required to contact trace?
So the rules around contact tracing changed about a week ago. And so the new updated guidance that is from the CDC, MDHHS, and the Detroit Health Department supports is we are only required to contact trace for higher risk school activities now. So we are no longer required to contact trace for lower risk school settings. That's classrooms, buses, et cetera. Contact tracing is no longer required. And the reasoning behind that is because schools have all of these other safety measures in place. You have social distancing, you're checking temperature, we have universal masking, we have electrostatic cleaning every night. All of these things are in place. And so the health department's perspective now is close contacts are not required to be contact traced for lower risk settings. Higher risk settings, yes. So certain athletics, lunchroom, classrooms that are being used as lunchrooms, where you're talking about a situation where a staff member may have been at the school contagious multiple days, contact tracing is still required. So the rules changed in the last week around contact tracing. Great.
Thank you so much, Alicia, for that clarification. Rajeshi, do you have anything to add?
Nope, same rules. I think, again, smaller communities in some of the smaller schools allow for whether it's formal or informal contact tracing. While it's not required, it can be done. And I do know that a number of our schools have sort of limited, as I'm sure DTSCD has as well, the number of those high risk events. And they're sort of watching the numbers to sort of determine their, if and when they will continue those kinds of things.
Rajeshi, there's another question. Thank you so much, Alicia Merriweather, for being with us today. We really appreciate it. Rajeshi, there is one other question that if you could answer it in the chat, and we'll have the moderators drop it to the person that asked it. It's, why don't charter schools offer testing every week like public schools do? I just want to reframe that. Charter schools are public schools. They receive public money. So I think just like let's level set, they are public schools. So Rajeshi, do you mind just putting the answer to that in the chat? And then I would ask Lindsay or one of our moderators to drop that into the Facebook so that person can have their answer. Rajeshi, it's so good to see you. Thank you for being here on the other side of getting interviewed, but always a pleasure to talk with you. And so now we are moving to our conversation with our doctors. We have Dr. McGrath he's an MD from Wayne State Pediatrics. He's an infectious disease and prevention doctor. So I would, if he could join us.
Yep. Hi.
Hi. Thank you so much for being here. We really appreciate it. And I'm sorry, there were just so many questions that were coming in from the audience that I wanted to get to a few.
No problem.
So I think the burning question for all of us is, when will Omicron be over? I don't know.
I've heard, yeah, no, it's difficult to predict with 100% for sure. But from what I had seen, and also from talking to some other infection control doctors at the Detroit Medical Center, the predictions are within the first week of February that the massive wave of Omicron should be, tremendously decreased by that point. So about hopefully one and a half more weeks at the most of this major surge. It's not that cases may not linger on a per patient or per person basis, but the wave and surge should be over.
Okay, that is helpful. So could you share the hospitalization rates and outcomes for kids in Detroit that are vaccinated versus the kids that are not vaccinated?
I don't have specific access to some Detroit specific, but the general admission rates for the state, I guess I can share this. Let me try to share this slide and then go to that slide. You can see what happened with let me show you this one. So if you just kind of look over the last, this is about 2 years almost a year and a half, you can see it goes back to, I think, August of 2020. The major surges that have come, the yellow line is here at the bottom. So the kids have really not been hospitalized too much throughout the pandemic, but you can see that when there was that mega rise with Omicron there, that, the whole population's rates all went up so high that, kids were included with that as well. So we did see for the first time sort of a giant leap in the hospitalization rates. And for the most part, it was higher rates than had been throughout the whole prior 2 years plus of the pandemic so far. So that's, sort of not unexpected in a sense when the whole country basically was having infection. Kids were not excluded. But I think for the first time, what we were seeing was more, kids who, some of them had been immunized, some of them could not be immunized. But on the CDC website, there is data for the patients who are immunized 12 to 17 at least. And for the vaccinated in that subgroup, the hospitalization rate was 9 times higher in the unimmunized. So, I mean, for me, it just helps. I mean, knowing specifically how many kids were admitted or not is not necessarily, but it does, if it's 9 times higher, then that would suggest that by getting immunized in whatever age group, you really reduce the risk of the child being vaccinated, or, by vaccinating them, you reduce the risk of admission or severe disease. I think that's pretty clear. The other thing is now this is updated for the most recent, and you can see that even now, as we talk from January 25th, basically Tuesday, these are all the cases, and kids, 0 to 17, if you will, they're still much lower than if you combine all these other older adult age groups. But one of the possibilities with those is that earlier in the pandemic, you remember with the lockdowns, kids were at home, and for better or for worse, they were at home. They weren't spreading it at schools and whatnot. And so all that time, adults were still, in a lot of cases, still going to work, still doing whatever they had to do, certainly if they were essential workers. So we, saw the higher rates, like much higher in the older populations beyond 18. So for the first time, we're seeing more admitted kids But I think that's just based on the number of kids infected. So, I think that's kind of par for the course in a way.
So I see you have slides, and I was just notified that you have slides. So if you want to go through the rest of them, that would be amazing.
Yeah, I tried to put together, based on the questions I got, just what's the rationale for kids over 5 getting immunized? Of course, there's been, even though kids, as I showed you, didn't have tons of infections compared to the adults, there's still 2 million cases. So it's not a number to sneeze at. And we know that kids can be really sick with it, hospitalized, have complications, and unfortunately die. So it's not that they don't get it. I think a year and a half ago or so, I was talking about myths of COVID, even at that time with this group. And some people just believed for the longest time that kids couldn't get infected, but it's just not true. We've seen these numbers in kids rise, like I said, specifically after lockdowns. And then the MIS-C is the multi-system inflammatory syndrome in children. Although rare, that can be quite severe. I know that Children's Hospital is taking care of, over 100, probably approaching 200 at this point, cases of MIS-C. And I've taken care of them in Flint too, myself at Hurley. So I know that although it's rare, the patients are still coming in. And again, that's usually 2 to 4 weeks after they had their initial exposure or infection with COVID. So this is something that, the vaccine in general prevents, and another rationale for getting immunized. Plus, it helps, if the infection is minimized at schools and at home, it just helps control the spread better. And then the other thing is that when you immunize the children, it helps protect family members at home and other kids in the household. That I think on the prior section, they were talking about, there's other kids in the households that couldn't be immunized yet because there's no vaccine for 4 and below. So when the kids who can get immunized are vaccinated, it helps prevent, major outbreaks, especially too, if there's family members with weak immune systems. And while it might with Omicron, I think this was the first time we saw major breakthrough infections in the immunized. But for the most part, even when I have some adult data that I saw, the majority still, it might not be 9 times higher, but the severely ill patients are usually unvaccinated. And so this helps mitigate that. And I think one of the biggest concerns for parents in the younger age groups was when they heard about the myocarditis. I don't know if you had heard about that yourself, but the sort of the heart muscle inflammation, or the sort of the lining of the heart, around the heart. I put a little heart there so you can see it's either the heart muscle itself or that lining around the heart, and that can become inflamed. But cases of that too were rare, and even for kids who got diagnosed with the myocarditis after the second dose, most of them were not too critically ill. Certainly they might have gone to the hospital, but most of them were treated with Motrin, like a couple doses. It doesn't sound like the majority had any significant issues. So I'm aware of it. I wanted to put that out there, like I'm aware of it, but I'm not against it. In fact, my own son, I think it was the second day that the vaccines were authorized for 5 to 11. Of course, I went and got him the dose here at my place of work. And he had his second dose, I think, on schedule, like 21 days later or something. So I advocate for it. I did it for my own kids. And my son is 11. So he was in that sort of, not 12 yet, and that older age group, 12 to 17, is slightly at higher risk than the 5 to 11. But I was definitely going to get him vaccinated as soon as possible. And for the parents who are waiting for the next vaccine for the younger age groups, keep the faith. It is coming. I don't know when. But that younger age group, there was an issue with immunogenicity after only 2 doses, because you have to keep in mind for the kids 5 to 11, the dose is lower. And it's actually a third of the adult dose in the vaccine. So, my son, as of my own case study, if you will, he had no problems at all after the first dose, but after the second dose, he felt like he was a little bit more sleepy, a little bit more achy for about 1 day, and then he was back to his normal, very energetic self. And then there was an earlier question about what are patients sort of getting now that they are getting Omicron, what are pediatric patients actually sort of coming to the hospital with. The majority coming to the hospital are having shortness of breath or respiratory with Omicron. Some kids, specifically, I took care of a really severe kid up in Flint with croup from COVID-19. Sometimes the fevers are high, and kids with the predisposition to febrile seizures may have a febrile seizure but that's not really COVID. That's with any viral illness that gives a fever, for those kids. And then the MISC is the thing. As of yesterday, there was over 6,000 cases with 55 deaths. So again, rare throughout the country, but severe. And so the concept that we could prevent almost all of those MISC cases with the vaccine makes me very eager to recommend it. And then there was a question about this quarantine, right? The CDC on January 4th sort of shortened the quarantine, and everybody was sort of like, what the heck is going on? We thought it was 10 days, down from 14 even initially, right? So there was a lot of confusion maybe, or, why would they do that? And it looks like it's based on this data, which is modeling estimates. It gave me a little reassurance, to be honest with you. Because I too, even as an ID doctor, I was a little confused about it when I heard about it. And I wanted to see what the CDC had looked into. So modeling data suggests that after the first 5 days of being infected with COVID, the risk of basically giving it to somebody else or transmitting it drops to only 31%. So that's why with this new set of guidelines, they said that for the first 5 days, if you're infected, you need to stay home. And at that point, if you test or not is up to you. But on day 6 and beyond, it looks like the risk of spread is only about 31%, as high as it was at the beginning. So that's kind of good news, and it drops even more every day afterwards. So this is the concept that you still wear your mask on day 6 through 10, but that the worst risk of spread is passed after the 5 days at home. And for some, this was like, well, it doesn't make sense to have any risk of spread. Why wouldn't you just keep them home until the 10th day? But this really wasn't necessarily for kids, although it might impact kids. It was more for areas where whole businesses were getting infected with Omicron, what you would consider essential services were getting infected, and places were literally like shut down and grounded to a halt.
Yeah, I'm in right now.
So that was part of it. I see Senator Peters is here. So I'll try to wrap it up. But the final thing was about masks and well-fitting masks and the sort of new guidance on masks. And remember that with Omicron, it's 3 times more infectious than with Delta. And even Delta, remember, was at least 2 to 3 times more infectious than the original Alpha strain. So it's kind of based on the infectivity or the transmission of variants that came the additional guidance about wearing the more well-fitting masks or the higher level masks like the N95s, the KN95s. For my own son, who has sensory processing issues, even at 11, I talked to him about changing our mask to either a surgical mask or with 4 layers or wearing the KN95. I noticed the KN95s that are readily available, they're too big for his face and they don't fit him well. Even if I make a small adjustment to the chin area or modify it by cutting a portion out, it doesn't get tighter. And then the surgical masks, he's got to flip the elastic wraps around twice to get it to be tighter, and then it irritates his ears. Or he can wear the cloth one that he can wear all day and doesn't touch and leaves it on. So for me, as a father, not based on infection prevention, but I know if he at least has that mask on and he doesn't touch it and he leaves it in place, I think that he's better off with that because it's a well-fitting mask than worrying about, having the KN95 or the higher level. So I think it's going to come. I mean, yes, if you are an adult and you can get a KN95 and wear it and, fit it snugly to your face, that's excellent. And I think that's going to offer you the best protection overall. But for children, I think you have to go case by case, child by child, that you're not making it worse by trying a different or more loose fitting mask. And so I think that's the last, this is sort of the rationale for mask wearing, which I think sometimes it gets left in the weeds. But if you have a sick person over here and an unmasked person over here, all four of these sizes of droplets based on this diagram can be inhaled. You can see the blue one actually gets the guy in the eyeball there. And then, but by both the infected index case and the exposed contact, wearing even a surgical mask, you really reduce, you can see there's a little bit of the red spread there. Those are the aerosol, very hard to deal with those, completely removing them. But the thoracic and the inhalable aerosols are minimized, if not, and certainly the ballistic drops are gone. So this is the rationale for wearing masks. That's been broadly recommended. So I just like this diagram because I think it really shows you kind of in a visual how much less a risk of exposure you have when you have somebody infected like that. So I don't know if you have any other questions or if I need to go.
No, I think that you have answered all of them. So wearing a mask is important and making sure that it fits is really important. And thank you so much for using the examples that you did with your son, because I think we have a lot of parents who have children that have sensory issues and have probably struggled to really work through how do I keep my child safe and also comfortable at the same time. I know that's something as a mom that I think about all the time. So thank you so much, Doctor, for being here. We appreciate it so much. And I am going to pass it on back, I should say, to Jametta so that she can talk with Senator Peters. Thank you so much.
Thank you.
Thank you, Dr. McGrath, and thank you always for grounding us in what it means to be a parent and those of us that are grandparents to protect our children. But there's a whole other group of folks that are about protecting us, and that certainly is our leadership, both that we have at the local level, but so important now at the federal level. Senator Peters, welcome to the COVID Coalition Town Hall.
It is. It's great to be with you. Thanks for having me on.
Okay, we're delighted. Now, we know we don't have you for the next 72 hours, so let's move on you while we got it. You're juggling a lot as well as the other folks in Congress. Could you help our audience better understand just a few nuggets? What is it that we have received through that very important American Rescue Act? And everybody keeps hearing infrastructure. Unbundle that a little bit for us, if you would.
Well, I'd be happy to. Certainly, we have had to provide an awful lot of support for folks and families who have been struggling with this pandemic for far too long. But we really passed some significant legislation to help folks starting earlier this year with the American Rescue Plan, as you mentioned, and a number of very critical pieces in that plan to provide resources to states and to local communities. One of those was the Paycheck Protection Program for small businesses that were really struggling and wanted to keep people on the payroll. We wanted to make sure folks continued to receive a check while we were going through this very tough time. That passed. It kept most of all of our small businesses in business while continuing to pay folks. So I'm sure many of the viewers here today were in those businesses that were able to continue to get a paycheck as a result of that Paycheck Protection Program. We also put in a provision specifically for restaurants, which were hit the hardest of all of these small businesses, and to allow them to continue to survive. Had we not done that, most of our restaurants, found themselves in a terrible position, and many more would have gone out of business than we have right now that would be able to stabilize that. The other key fact was, of course, the stimulus check that provided an immediate infusion of money for folks and families, as well as the child tax credit that provided an additional tax credit for individuals with children, both very young children as well as children up into high school age. And that has been absolutely critical. The infrastructure bill that you mentioned deals with the physical infrastructure, our roads and bridges, investments in our ports and airports. And it was something that has been long overdue. In fact, if you look at folks who study the quality of our roads and bridges and all of our infrastructure, which is critical for our economy, it's critical for jobs, it's critical for just getting around and not hitting potholes and all the horrible things that can happen if you're not maintaining infrastructure. If you look at it on a worldwide basis, they rank the United States 13th in the world in terms of the quality of our infrastructure. This is the United States of America. We don't want to be ranked 13th in the world. We need to have first-class infrastructure, and that's what passed. And you're going to see that immediately in fixing bridges, hundreds of millions of dollars and billions of dollars coming for bridges as well as roads into our state. So as the construction season kicks off here shortly, as spring comes along, you're going to see even more robust construction. The other thing that I think is vitally important is there also investments in online infrastructure. Here we are on a Zoom call. Exactly. You need to have access to the internet. High-speed broadband internet is absolutely essential in today's world, but not everybody has access to it. In our urban areas as well as our rural areas, we've made substantial investments now so that nearly everybody, or the goal is to have everybody in our state, no matter where you live, can have access to quality, affordable internet service. And maybe I can just put out one that really impacts people in a very direct way, is that part of that is to make sure it is affordable. A lot of folks find that internet is not affordable and high-speed broadband is not affordable in the greater Detroit area. And we now have a program that will be kicking in to provide assistance to families that you can get up to $30 per month to help you pay your internet access bill. So the FCC is rolling that out. And I would just encourage all the viewers here today to take a look if you qualify. Over 2 million people will qualify for this additional help in the state of Michigan. You can just go to the website, the FCC, which is the Federal Communications Commission, but it's just fcc.gov. And I think it's right on the front page. This program is going to start in March. So we're just a month away. And I would certainly encourage folks to go to that website, because you may very well qualify to have $30 a month provided so that you can have high-speed broadband internet afford the monthly cost of it.
That's fabulous, because we know how important the digital divide is, certainly for telehealth, for our schools, and also for people to find the jobs that are right. Available. Senator Peters, 2 other questions before you leave. One of them you touched on with the infrastructure. We know that Michigan has been adversely impacted around lead quality, relevant to our water. And also we've had the misfortune of some storms. Can you talk about in what ways the infrastructure dollars or some of your work is helping to make sure that we have clean and accessible water?
Well, absolutely. And it is fundamental to the community to have clean drinking water. The lead contamination, of course, we saw the tragedy in Flint, but we know although urban areas all have too many lead service lines, the infrastructure bill provides resources for local communities to start pulling up all of those lead service lines and replace them with something that is safe. So we will see that money getting into our communities very shortly to make sure that we're protecting homeowners and folks who are in older buildings that have lead service lines, to know that those can be replaced. So that's happening now. We're also actually another contaminant, which is PFAS, which I'm sure a lot of your viewers have heard about. We also have major investments to reduce and to eliminate as much PFAS contamination as we possibly can. You mentioned the Storm Act, and this has been an issue that's hit us in the Detroit area in particular, and that's flooding as a result of very severe storms that have hit. And what we know is the result of climate change we're seeing it every season, We get more storms, and when we get the storms, they tend to be a lot more severe and dump a whole lot more water than what we've seen in the past, which really overwhelms our infrastructure and our sewer systems. So I authored legislation that has passed into law over a year ago, and in the infrastructure package was funded with over $500 million to provide very, very low interest loans to communities to strengthen that infrastructure so they can handle the big storms when they come. It makes a whole lot more sense to build things stronger than trying to pick up the pieces. So when they get overrun as a result of a tremendous amount of water that's coming into those systems. In fact, from a taxpayer perspective, every dollar we invest to make our infrastructure stronger, we end up saving $6. It's a whole lot more expensive to pick up the pieces. And of course, it's a horrible thing for anybody to go through that's had flooded basements and other impact as a result of flooding. So that's in the infrastructure bill as well. You'll start seeing those critical investments being made in the months ahead as well.
That's excellent. And as you made the point, prevention pays off. It is an absolute return on investment. But we have one last really important question for you. And we know that you've been thinking about this too. And it's the reality of our voting rights. And we know that many of us, we stand where we are based upon the struggles for voting rights and opportunities for Black, Brown, and all Americans as citizens. Could you talk to us about what you envision as being the path forward for the voting rights? And what do you advocate to us as citizens, how we need to be involved around leadership, whether it's our schools, whether it's Congress? Senator Peters.
Well, yeah, absolutely critical question, because there isn't anything more fundamental to our democracy than the ability to make sure that you can vote, that your voice can be heard, and have an opportunity to get the change that you desire through the ballot box. And unfortunately, we've seen many state legislatures, and I'm going to call it what it is, strictly Republican efforts to try to make it more difficult for people to vote. And it's really, it's an attack, in my mind, an attack on the very foundation of our democracy. And when you think of what happened in this last election in 2020, which was an election, despite what people are saying, it was fair, it was free, no evidence of widespread fraud. And what we should really celebrate, here we were in the middle of a pandemic, and yet we had the highest turnout of voters that we have seen in recent history. We should be celebrating an incredible success that people felt empowered. They felt that they needed to have their voice heard. They went out and voted in record numbers, even though we were in the middle of a pandemic. And yet now you have state legislatures that are trying to make it more difficult, roll it back and make it more difficult. We need to step up, certainly at the federal level. We're going to continue to fight for that, to put a floor there. But really where this goes is our state legislature. So I would encourage the viewers here that are watching, that care deeply about this issue, and I hope we all care deeply about this issue, would reach out to the state legislature and talk to your local state representatives and senators and make sure they know that this is something that you care deeply about. Our democracy requires us to continue to protect those very basic rights, and that they will be held accountable if they start rolling back these protections that voters need.
Yeah, absolutely. And in terms of transparency and accountability, we so appreciate you taking the time out, but that's what you do, is to come and speak to the people, to give us a voice for not only your platform, but what we should be doing as a community to support and move democracy forward. We hope that you'll join us again, and then hopefully in a couple of months, we can talk about and celebrate some more victories, whether it's voting rights, whether it's having cleaner air and more funds for our children to get back to school with quality and great childcare.
Absolutely. Thank you for having me on. I look forward to being on again. Thank you.
Okay, it's a joy. Thank you. And Christine, then I'm going to hand it to you to go ahead and wrap up, because we got some great announcements, and we hope that everyone, all of our guests today, are feeling empowered and feeling special, because this is what community is all about. Christine?
Thanks, Jametta. Thank you all for joining us. It has been a pleasure. Thank you for all the comments and questions. It was great to hear from folks today. We'll pass along all the comments that we heard today to the folks that need to hear them, and it was just really a pleasure. The two announcements that we have is that the next 3 shows or town halls, I should say, will be focused on mental health and mental wellness. So please come back, join us. This has been a really hard 2 years, and I think we all could use a little support with how we move forward, not just with our physical health, but also our mental health. And then lastly, you and I, Urban Neighborhood Initiatives, will be hosting Wayne Health Mobile Clinic and Vaccine Drive tomorrow, so the 28th, from 1 to 5. It's at 8300 Longworth in Detroit. And so if you liked what you heard today from the doctor about vaccines, we are giving Wayne Health is giving vaccines to young people as young as 5 and as old as you are. And so please come and get your vaccine or get tested. If you're concerned that you were exposed, come on and get tested. And they are wonderful and provide a lot of support. So everybody have a really good rest of the day. Thank you all for being here with us. We'll see you later. Stay healthy, stay strong, stay powerful.
Christine, we have 3 more announcements, Christine. You can just scroll down on your script.
Ready? I'm so sorry. So Kevin's song, there is a free day. It's live on Facebook, Surviving Suicide and Erasing the Stigma. That is produced by Detroit Public Television. That's on Saturday from 8 a.m. to 1:30 p.m. Please join us. This is a conference on suicide. Can we go to the next slide? Thank you. Oh, the Sphinx organization, the
Yes.
25th annual Sphinx competition, junior and senior division finalists. Here they are, their pictures. And so that is really exciting.
Christine, there's some script in the chat on when that is too. If you look in the script, there's a time for that on DPTV. It's going to be live streamed.
Oh, okay. Sorry, I needed to keep scrolling. I'm so sorry. So live stream concert this Saturday evening at 7 p.m. The Sphinx organization. This is a competition concert for Black and Latino and other young classical string players of color. You can watch it live on Detroit Public Television Facebook page. So here is the flyer that you just saw. You see it up. And then Detroit Parent Network has Teen and Vaccines Healthy Family Cafe on February the 8th from 6 to 7:30 p.m. They'll be answering questions on what teens and their parents have to know about vaccines, boosters, and COVID. Go ahead to Detroit Public Television's Facebook page. They'll have updates and registration for the event next week. So next week, look at DPN's Facebook page if you'd like to register for that. And then there are free COVID testing kits that you can get through the government, and we're going to drop that in the chat. So you just click that link. It's really easy. You put in some information, your address, I think is your name and your address, and you will receive your free at-home testing kits. I did it the very first day. It took me literally 30 seconds probably. I'm still waiting for them, but go ahead and do that so that you have some free testing kits for when you need to go somewhere and want to know if you have COVID. So thank you all so much. Have a great rest of the day. Stay healthy, stay powerful. We'll see y'all later. Thanks.